Welcome back, everybody. So, having moved to lockdown level 1 this week, there is much concern about people, firstly, not adhering to the wearing of masks or social distancing, and also of that fatigue, that pandemic fatigue. Health Minister Dr Zweli Mkhize has also warned the current infection rate of 10,000 per week is actually much higher. Many other countries that had eased lockdowns are now experiencing a second wave of rising coronavirus infections. Our next guest, Dr Kerrin Begg, who is a public health specialist at the University of Cape Town, has been with us before to warn of that thing called epidemic fatigue, and she joins us for a bit of an update, an important update, I think, at this time. Good to have you, Dr Begg. Thanks so much for joining us.
Good morning.
So
Thank you for having me.
Pleasure. We talk about this epidemic or pandemic fatigue. Perhaps you want to give us another definition of what we're talking about.
Absolutely. So what happens in any threat type environment, which happens in the early parts of an epidemic or pandemic as we're having now, which is worldwide epidemic, is that we end up with this threat and we have a response, which you will know as a fright or flight response. And so it's an innate response that gears us for our bodies to have the hormones that then gear us to be responding to either flee, run, or to fight. And so in the early parts of the epidemic, we're on high alert, our adrenaline is running, and we're scared, and we need to respond. And so we start responding either by running away and hiding at home, or we gear up and modify. Because we can modify our responses, we start listening and doing the things that we're told to do. But as time wears on, and we're now a long way down the line, we're now 6 months down the line of a significant epidemic in South Africa. From a pandemic point of view, we've been used to the news now for over 9 months. Our body gets exhausted, and that fight or flight response no longer activates quite as properly anymore. So it's a bit like listening to a fire alarm going off solidly for 9 months. Initially, you're looking around and needing to know what to do, and you're responding to what people are telling you to do. Now it's just become a distant echo, and you're able to actually start ignoring it. Yeah. And unless the epidemic is very close, and you've seen somebody affected, you know of things personally, the stats actually start to desensitize you. So when things are increasing from 10 to 20 to 50, we can still visualize that number. When we start now talking about 655,000 deaths, 55,000 cases in South Africa, our eyes go a bit dazed, and we can't really comprehend that anymore. And so we start to become not quite lazy, but certainly desensitized. Yeah. And so we continue to do the normal things of life, which means that those kinds of things are things that put us at risk of transmission of the epidemic.
It's quite amazing. I mean, I've been having these conversations with a lot of people, and, you know, I mean, I work and look at the numbers every single day, and we talk about these things. So for me, it's top of mind all the time, and, you know, it's something that I have to follow. However, some people have really, and I would say the majority of people I speak to, they've switched off. They've kind of, when I said to them, do you know that we're sitting on 183, day 183 of the lockdown? They're like, you kidding me? Never. I didn't believe that. And when you tell them, you know, where we are at in terms of infections, are you serious? That many? No, I can't believe it. So people have almost sort of like now, okay, it's happening, but it's fine. It's just other people's problem, not mine. I'm fine. Let's just get on with our lives. And that's a very, very big concern, because there is the issue that there is a second wave. We don't know if we will get it or to the extent we'll get it, but there are many countries that are experiencing a second wave bigger than the first wave ever was.
I think part of the challenge is that we don't, as humans, actually cope terribly well with uncertainty. And so one of the struggles is that, obviously, as scientists and researchers and doctors, we're delighted that we have been getting to know a little bit more about this disease, because it's still been so unknown. But for many, the unknowns are very uncomfortable. So do we have immunity? Don't we have immunity? Will a vaccine work? Won't it work? Will herd immunity work? Won't it? Will there be a second wave? Won't there? Those are the kinds of things that actually our brains don't tolerate very well. Our brains prefer to tolerate certainty. And so people, it's easier to switch off.
Yeah.
It's very difficult to live in a high degree of stress for a long period of time. And so one of the challenges that we have to do as health, both as the health ministry and as healthcare practitioners and as responsible citizens, is that we have to convert this into something that becomes habit. So similar to many years ago I think that maybe you and I can possibly remember a day when we didn't wear, when seatbelts were not routine. Yeah. And now we wouldn't even dream of getting into a car without seatbelts, without putting seatbelts on and without strapping our children into car seats. And there was a day when that was not routine. And now we need to get society into that space where going out without a mask is not okay, and that needs to become part of day-to-day routine. Yeah. And the choices become which mask do I wear, not whether I wear a mask or not.
And that's the right. So it is the right thing to do. But I'm already noticing, and I don't think I'm alone in noticing this, that in general, people are starting to slip on wearing masks. That in terms of, if they're going out to restaurants, obviously you're eating, so you're going to take that mask off. If you're in a bar or a pub or wherever you may be, you take the mask off, it doesn't matter. Especially amongst the youth. They sort of, you'll take it with as almost like it's a new neck piece. And this is becoming normal. Unless, of course, you're in an environment like a school or at an office where there are laws in place where you say you have to wear it and people are guarding and watching you. But the minute you're not in that, those masks come off, and that's a big worry.
Yeah. And that is exactly part of the challenge, is that we need to get beyond it being because it's a rule. It needs to become part of normal, what we do every day. And that's, it's one of the big struggles that actually we need to be caring for our fellow human beings, that we need to be acting as if we each have COVID and are wanting to prevent other people from getting it, rather than it's not about me, it doesn't affect me, it's okay, I'm all right, and whatever happens to other people, I'm not really worried about. Yeah. That's really the kind of the kind of mindset we need to get to. There was a well-known personality that I was scanning through on Instagram and noticed with horror. So I have those horror moments on a daily basis of the person in a club with very little physical distancing. In fact, people were cheek by jowl, no masks. And I messaged back to say, where are the masks? Where's the physical distancing? And he went like, well, hey, man, life goes on, hey? Yeah. And that's exactly the kind of attitude that we have to get away from. So we need public persona to be modeling the good behavior. We need mask wearing and physical distancing to become the norm, that it is the same as climbing into your car and subconsciously putting a seatbelt on. So we need it to become habit. That it's you don't even think about walking outside the house without a mask on. Yeah, it's amazing. That as soon as you come into contact with other people, you're automatically judging the distance and standing away, so that you keep your physical distance, not for your protection but for their protection. Absolutely. And I think that needs to become our norm, is that we're thinking about how can I protect others? How can I make sure that this disease stops with me if I have it, and make sure that it goes no further. And that's the kind of habit forming that we need to be creating, not the fear-based response anymore. And I think that perhaps was one of the errors that we made early on in the epidemic, was that the kind of terminology we used in the public health space was fear-mongering, was war, we need to fight this, it's an enemy. And that people do get fatigued by that quite early on. Whereas I think that we can now really work hard on getting that this is the right thing to do, although, as we know, paying your SABC TV license, that messaging doesn't work either. So we've just got to get it into the habit of holding people accountable when we're around other people, and and making sure that we're doing the right thing all the time and model.
Kind of like a civil policing. If you're not wearing your mask, point at someone and say, come on, put the mask on. But it was.
And interestingly, young children are adapting very quickly.
They're much better
in
at
the schools-based environment. I think that we thought that young children, and they continue to surprise us all the time, that young children adapt the fastest.
Yeah.
And so, they're happy to be sitting in class with their masks on, making sure the physical distancing is difficult in kids because they naturally congregate to each other. Games are, it's our nature to group together and to engage and chat. But it just needs to become part of the norm of what we do.
Amazing.
Is that for quite some time to come.
And the one thing is, I mean, you spoke a bit earlier about that, putting fear into people. And at one stage, when we were told to stay home, South Africans were amazing. They stayed home. There was a sense of a lockdown. We've got to work together. We've got to make this happen. And then, of course, we saw the peak coming and people still being very, very nervous and being vigilant and almost looking down on other people that were not abiding by the rules. I am noticing, and please tell me if I'm wrong, I'm noticing a bit of a shift now where it's like, there's the school of thought where it's instead of being so anal, if we can say that, and safe of, still sanitizing your groceries and staying away and being at home and not going to public places and all of those. People are almost like, oh, come on, really, you've got to get back to your normal life. Like, what is wrong with you? There's that shift almost of, if you're being too careful, people are looking like, what's your problem? Come on. If you're going to get it, you're going to get it. Let's just move on. And really, it's like a flu. It kind of shifted back to that. And I think you mentioned this in the beginning of the interview. If anybody has seen somebody suffer through coronavirus or has lost a loved one to coronavirus, you know that it's almost like a Russian roulette. You don't know what you're going to land up with, and that's the reality.
Correct. And I think that what we're still only learning about, and I think that's one of the greatest difficulties, is that there's still so much unknown. Is that we are seeing this long COVID, which is a certain proportion, and we don't know how many yet, are experiencing protracted, long symptoms of months and months and months, where they're unable to return to normal functioning. And this is not just in those with comorbidities and those who are struggling who had been struggling before, but in previously very healthy individuals who are now struggling to breathe, struggling to get back to any form of normal day-to-day living. And so it's not just about let's get it and get it over with, because actually you have no idea whether you'll be affected with long COVID going forward. Yeah. So, the idea really is that this is not like the Spanish flu epidemic, where we had no options of vaccines at that point to be able to protect us going forward. The only ways of protecting us were non-pharmaceutical interventions, being masking, physical distancing, staying at home. And then we didn't even have options of social media to communicate what we were learning about very quickly. But so we just need to be making sure that we can stay home until we can get such things going as a vaccine, to be able to make sure that we can develop herd immunity and then be able to return to some form of normality. Yeah. I think the other thing that people forget is that these measures are also protecting us against things like flu. So we've had the lowest flu incidence that since we can remember, in terms of, so we do this national seroprevalence survey that we look at, that we review every year, contribute to the WHO stats. And we've seen an unbelievable drop in flu outbreak this year, which is a wonderful side effect of wearing masks and physical distancing, is that not only are we preventing COVID spread, but we're also preventing influenza spread, which means that we've saved a number of lives of those who would have normally succumbed to flu. Yeah. So we're doing good in a number of other ways as well, in preventing other forms of respiratory spread infections.
Dr. Begg, I just want to quickly...
But it is something that we
do. Just very quickly, we're running into time problems. I'm going to ask you two very quick questions. I mean, we're seeing international travel opening on the 1st of October. So we don't know which countries as yet. We still need to see that list of the countries that are allowed to travel into South Africa and where South Africans are allowed to visit. So is this not a big risk? I mean, I know it's on the premise that you have had a test 72 hours previous to traveling, but this is, again, we're bringing in sort of a lot of people into the country now, and the talk of different strains and things like that. Is this a worry on your side?
It is a worry, but at the same time, our government has the most unbelievably difficult decisions to make around walking this tightrope of making sure that we save lives through protecting from coronavirus and the effects of COVID, at the same time as saving the economy and saving lives from the economic impact. And so it's done with mitigating risks in mind, that people are taking tests beforehand, that countries are assessed based on their risk. So whilst it is a grave concern, it's done with risk mitigating measures. And so that's all that we can ask for. Yeah. What we really need to do is make sure that those here are mitigating risk as much as they can, which is mask wearing, washing hands, physical distancing, staying at home when not well.
Then just finally, given the numbers that are coming out every single day, I remember the World Health Organization had said that the infection rate for the test rate to the infection rate, the ratio should be below 5%. South Africa has kind of stalled at around about 10% when we look at the tests and the infection rate. So, we hover below 2,000, maybe sometimes just above 2,000 or just below 1,000. So, but as we heard the minister saying, 10,000 a week, but realistically a lot more than that. What does that say to us? I mean, this is nowhere gone. I mean, it's still there, but perhaps we're just not giving it. I don't know. You tell me. What are the numbers telling you?
So the numbers are saying that we are still having significant numbers. And remember that on the upswing of the curve, these numbers would have been very scary for us in terms of the number of infections per day. Remember that when we were doubling our rate from 50 to 100, that was really scary. We're still sitting at between 1,000 and 2,000 a day, which is significant. But the challenge is that, of course, we're on the down surge, so people are considering that therefore things are so much better. But we still need to be exceptionally careful. It is unwise to be blasé about COVID. Some people have been incredibly fortunate that they've had incredibly mild disease and have managed to recover fully. But that is not the case for everybody. And so all of us need to be making sure that we try and avoid infection as far as possible. We, of course, know that many have also had asymptomatic infection. And that's why we all need to pretend as if we are positive and make sure that we're not passing it on. Because those asymptomatics, we know from the seroprevalence survey, which is the testing of antibodies in the general population, we know that in the 2,500 odd that were tested in Cape Town, that up to 40% have had COVID unknowingly. Wow. And so they may well have had asymptomatic infections. So we can't assume that just because we don't have symptoms that we haven't had the disease or don't have it right now. Yeah. And so we all need to be, rather than thinking I mustn't get it, we need to be thinking, pretend I'm positive and I must make sure that I don't pass it on to anybody else.
Amazing. Good advice. Dr. Kerrin Begg, thanks very much for talking to us here on the programme. A public health specialist at the University of Cape Town, talking to us and warning South Africans about pandemic fatigue, as this, of course, may increase the risk of infection. Sakina, interesting there.
Very interesting.
You've got to listen to these interviews as well.
You absolutely have to, because it's worth pulling ourselves back, but also, again, it's becoming so much harder with the weather conditions that I'm worried that may be another